5 to 10 milligram per kg. Induction time is 5 to 10 minutes. It is a good choice of any animal with different neurological and severe disabilities. Anesthesia method. It is also same as xylazine chloride is 5 milligram per kg. Gentamicin for 3 to 7 milligram per kg body weight. Induction time is 5 to 15 minutes, and recovery we can get in leopard is 35 to 90 minutes. Okay, this is all regarding the big cats. Hello. Hello. Hello.
Hello.
Hello.
Yes, doctor.
Yes, sir.
Topic is open for discussion. Participant can ask the question. Yes, ma'am. Chat में है question कोई. So if anybody have any query, please ask. Or you can write in chat box. Okay, I think there is no questions. So thank you very much, doctor, for a nice presentation regarding the chemical resistant in big cat. Thank you very much.
Thank you, sir.
Now I declare this morning session of 2 days. We again assemble on 3:15 p.m. for the afternoon session. In the afternoon session, there are 2 lectures. One regarding elephant and another for crocodile. So thank you very much to all the participants. There were Chairman Dr. Sabapara sir, Dr. Bagamsi report here. Thank you very much. Bye.
Now, hello, Dr. Ansu.
Yes, sir. You are audible, sir. Audible as well as visible.
So my students are also waiting here.
Yes, we can see them, sir.
Many more participants. Okay, so you tell us when to start. Okay.
Just
Okay.
2-3 minutes, sir. At the most 2-3 minutes, sir. Thank you. Vishal Sharma, sir.
Yes, yes.
Good afternoon, sir.
Afternoon. So,
Sir,
yeah, go ahead.
Sir, we have with us the chairman of the session, Dr. G.P. Sabapara, the co-chairman of the session, Dr. Vishnu Dev, and we also have the officer who is handling the IDP activities of our college, Dr. A.K. Sharma, sir. So I now hand over the session to the chairman and the co-chairman for a brief introduction of our speaker. After that, we will start with the lecture.
Yes. Yes, sir.
Good afternoon, sir. Some brief introduction about Dr. Kushal Kanwar Sharma. Sir, serving as professor and head Department of Veterinary Surgery and Radiology, College of Veterinary Science, Kanpur, Guwahati. Sir has graduated from the College of Veterinary Science, Assam Agricultural University, Ampara in 1984. Obtained the master degree in the subject of veterinary surgery and radiology in 1986 and PhD degree in the same subject in 1994. He had experience of more than 33 years of the field of teaching and research. Sir has guided 44 students of MBSc and PhD. Dr. Kushal Kanwar Sharma has been conferred Padam Shri Award for his outstanding contribution in the field of wildlife treatment and Asian elephant conservation, declared on Republic Day 2020. Governor of Assam has given him the title of Elephant Man of Asia. Sir has attended over 700 elephants in a year for over 3 decades. He has recipient of 28 national and international awards, including FIS-DS and FIS-APM. He has completed various research projects sanctioned by the Ministry of Environment and Forest, Department of Biotechnology, as a principal investigator and co-PI. Sir has published 151 research papers in various national and international journals, published more than 100 popular scientific and wildlife adventure stories, and 13 books. He has conducted 19 national and international training programs, delivered lectures on elephant care, immobilization and surgery, management and welfare, human-elephant conflict, wildlife disaster management, rescue, and translocation of wild animals, etc., all over the world. So, sir have so vast experience regarding the elephant as well as in the research in the surgery and radiology. So, definitely our participants have benefited for the lecture. That's the experience of the sir. So, I hand over this mic to the Dr. Kushal Kanwar Sharma, sir. Sir, please.
Thank you, sir. And first of all, let me thank you profusely for inviting me to share my experiences with your students. And fortunately, some of our students have also joined us. So let us hope that I can throw some light on the topic delivered to me, given to me, that is breathing in elephant as well as the health issues. So I have very hurriedly made, because two topics are a little bit different, but I have tried to combine it. So first I will discuss the breathing part, then I will go for the healthcare part. And I understand that I have 1 hour time for delivering. So I want to share the lecture, please. The host has disabled the my screen. So please enable to share my screen. Share screen. First. Yes. Now, first to draw. Okay. So good afternoon, everyone. My screen is visible there.
Yes, sir.
And I am sure I am audible also. My voice is quite loud. Maybe it can be heard from Gujarat, even without a mic. Anyway, so the topic that I have already mentioned is breeding and health aspects in Asian elephants. Next, please. That's it. Okay, so we can define breeding or procreation as a sexual reproduction that produces offspring. It is necessary for continuation of a species on Earth. Procreation is an instinct of any living creature which is regulated by sex hormones, and success and failure of natural breeding is influenced by many intrinsic and extrinsic factors, that is environmental factors. So this, what I have mentioned, all these things are already known to my veterinary friends, my students as well as the seniors. So I do not have to explain. Next, please. But we have to remember. So you can see this is a nice, because we are talking about elephants. And when we are talking about elephant breeding, I understand that we are talking about breeding in captivity. So when a captive population is breeding, we can say that breeding can be considered as a reflector of good health. It reflects good health. It is so a particular elephant population that is not breeding is not a healthy population. So I am from Assam, and you know we have the highest density of Asian elephants in the entire world. So out of about 47,000 Asian elephants in the world, Assam alone, Assam and northeastern states, we have 10,000 elephants. So almost 1/5 of the or 20% of the population of Asian elephants in Assam. So I have been working here, and I did not realize that there may be elephant population that is not breeding. So I only seen this when I worked in Indonesia, that in 5 elephant camps, what they call as ETC, elephants were not breeding. Then only I realized that there is something wrong. So after getting this type of situation, then I started pondering over that what are the factors required for the captive elephant population breeding. Next, please. So before going into the depth of the subject, I want to have an outlook on the reproductive biology of elephants. So since elephant is an alien species for many of my audience today, I want to give some even basic information. So age at maturity in case of a female elephant is 14 years. In case of a male one is 18 years. Now this is an average age of maturity. In course of my discussion, I will come that female elephant I have seen only recently. We had to attend a delivery case in a female elephant, which was just 8 years old. That means she became pregnant at the age of 6 years. Of course, in case of male, that kind of thing doesn't happen, but the average age at maturity is 18 years. But in zoo conditions, when the keeping quality is very good, nutritional plan is very good, they can become mature even a little earlier. Gestation period is 19 to 21 months. Intercoming period is average 4 years. I have seen much less than that or longer than that, depending on the density of elephant in a certain area or the nutritional plan and all that. Then estrous cycle is the longest among all mammals, that is 13 to 18 weeks. And the hormonal cycle is little bit peculiar in case of elephant. The peculiar urogenital tract anatomy of male as well as female elephants, the formation of multiple corpora lutea and the type of secretion pattern of reproductive hormone is peculiar. and many people doesn't know that there will be many corpus luteum in a pregnant elephant, unlike just a single corpus luteum in case of other mammals. Then progesterone, there is a biphasic elevation of progesterone. So that is why elevation of progesterone alone cannot be considered as a sure shot recognition for pregnancy. Generally, we have to go for prolactin estimation. Now, interestingly, prolactin hormone increases continuously till the end of the gestation period. So, if we are estimating prolactin, if you are estimating hormones for marker of pregnancy, you should go for prolactin estimation. Next, please. Now, breeding in elephant. Next, please. So, this is a natural breeding, but there are many such institutions globally where the natural breeding doesn't happen. Like in Europe and America, where probably you all know that these countries, they do not have Asian elephants naturally. But in the previous centuries, they have taken many elephants from the Asian race countries like India in particular, then Thailand and Myanmar, to many countries across Europe, America, New Zealand and Australia. So there they don't have enough number of elephant breeding population. Somewhere they have 2 females, in another place they have 1 male, but most of the time they have females only. So they have problem in breeding, and in the meantime, CITES have given a ban on purchase of elephants. So now these countries, they cannot purchase elephants from Asia. Therefore, they have invested in artificial insemination, and they have perfected the artificial insemination process. But this is a very expensive and very tedious process. So here you can see in the first case, they are collecting semen from a bull by electroejaculation method, and for that also you need to train a bull, and which is very difficult. But you can also do electroejaculation from a bull under sedation. Then the artificial insemination. So here this is ultrasound guided insemination program, but to find out the exact timing for insemination is very difficult. It's not like cow or bovine, I mean. So you need to estimate the hormone level, and there is a precise level of hormone. So, but the good thing is that you can collect blood samples, and every day you can estimate the hormone. And actually, 2 German veterinarians, they have initiated this program, and this is Professor Smith from Massachusetts University. So with him we also work. I will show you pictures of that. So they have perfected the artificial insemination program. But I think in Indian context, we still would prefer natural breeding rather than artificial insemination. Next. Now pregnancy, as I said, what are the markers of pregnancy? Mammary development is visible by 6 months. So if it is a tiny elephant, even by looking at the progress or growth of mammary gland, you can judge that probably the female is pregnant. You know, they have a pair of mammary glands which are located in the pectoral region. Then there is ultrasonography. For ultrasonography, you need a probe extender actually, because probe has to go parectally, and then only you can find the location of the fetus. And then hormone assay, and as I have said, prolactin hormone is the more important marker of pregnancy rather than progesterone hormone, because progesterone has a biphasic rise. Next. So here you can see, just now I mentioned about Dr. Smith from Massachusetts. So with him, we work here and for ultrasonic diagnosis of pregnancy in Assam. Now that for this purpose, you need a particular type of ultrasound machine, which is can be fitted on a belt. The normal ultrasound machine is difficult, and additionally, you need a probe extender. So next, please. On ultrasound, this image of a fetus inside the mother's utera. So confirming pregnancy. Next. So here this picture shows the location of a fetus inside the uterus, inside the abdomen. So you can see anyway, so you can see the location of a fetus. Now it is not like what you see in case of other animals. And if you can correlate this picture with the other picture, you will find that the hind limbs are coming first. So this is a normal. Yes. So normal presentation. So hind limbs coming first is a normal. So in a normal elephant, with good amount of exercise or proper growth of the animal, dystocia is very uncommon. But next please, we have come across such cases. You can see just delivered fetus. Next please. So when in a herd a fetus is delivered along with the placenta, you can see the whole herd become agitated, and the mother will give a kick to remove the placenta, and that kick also gives a stimulus to the baby, and eventually the baby will get up very quickly. Next please. And another thing we must remember, that whenever a female elephant or young female elephant is delivering her first baby or even subsequent baby, and senior auntie is very helpful in case of elephant. So presence of a matriarch or a senior elephant actually increases the chances of survival of a calf very highly. In presence of a senior elephant, because she will give the moral courage and she knows how to support. So that is why never keep like coming mother alone. Always there has to be a company. Sorry, the previous one. Previous one. Huh? Yes, just delivered calf. And just now I have mentioned about the dystocia. So this was a case recently we had to attend, unfortunately. This was a wild female, and the evening that we had to attend her, like whole night we struggled very hard. A whole team of 15 people. You can see the normal presentation was there, but because the mother was very, very young, at the time of delivery, she was barely 8 years old. As expected, she had a dystocia because the baby was a male one and very big in size. So there was a disparity of the size of the baby and the birth canal. And in spite of our tremendous effort, and in spite of doing episiotomy, we could not manually deliver. Whole evening we struggled, and next morning only after a lot of lubrication, the cup was pulled out with the help of JCB. Next, please. So once again I say that suppose this is the mother, and you can see the senior elephant supporting her, and this is how they actually communicate, verbal communication, giving assurance. So they are very social animal, and for success of breeding, actually mere presence of one female is not enough. There has to be a group of females. One male is okay. His job is done once he is impregnated. But a group of animals, female elephants together, makes the difference. So I said captive breeding. For captive breeding, we have to select the proper age of breeding, proper nutrition of the animal, then exercise. Because in field conditions, elephants keep moving for 18 hours a day. Hardly they relax for 6 hours. And in captivity, we do not give them enough time to go for walking and exercise. That makes them vulnerable for dystocia and all that. Then, as I said, socialization. Then I want to discuss about the health management in captive elephants. So maybe relation is there also, but okay, let us talk about it. Now, health and disease. Now, how to define health? We all know as a doctor that when all the systems of the body are functioning normally and there is no deviation from normalcy, we say this is health or healthy animal. Any deviation from that is disease. Now, signs of health in case of elephant. Alert disposition, bright and moist eyes. Eyes are very good reflectors of a healthy animal. And in case of elephant, continuously flagging of ear. They flag their ear to cool their body because in the ear veins are superficial, so easily they can dissipate heat. As well as that will also fan their body. That is normal behavior. Movement of tail and trunk, very restive. Then they wear weight on all limbs and give rest to limbs alternately. And they feed continuously. As I said, they move 18 hours a day. They also feed 18 hours a day. Their digestive capacity is more. They eat what they eat, they can digest only 40%. 60% is expelled as stool. So they need to keep eating. Signs of health continue. Tip of the trunk will be moist. Oral mucosa will be rosy pink. They have a resilient and elastic wrinkled skin. Quality and quantity of urine and dung are important things. How many times they have urinated, how many times they have defecated, they all have standards. Okay? And the color, consistency, then presence of moisture, even mere looking at the dung, you can give 20 information about the health of an elephant. So also urine. But again, sometimes they mislead us from eating a particular type of vegetation. The color of the urine may change also. Then body temperature normal 96.6, pulse 25 to 35 normal, respiration also. Standing and recumbency variation is there. Pulse also varies little bit. So in case of lateral recumbency, the respiration rate increases to 12 and standing 4 to 6. Then signs of indisposition. What are the signs that we can suspect that an elephant might have some problem? It looks listless and drowsy. Skin will be dry or dehydrated. Eye will be dull or sunken with profuse lacrimation. Shriveled trunk, mucous membrane of palate, tongue and trunk will be muddy, pale or yellow in color, rise or fall of temperature. Then anorexia and reluctant to drink. Means every symptom will not be there. Some of these symptoms should make you suspicious. Tongue will be loose or watery with blood or mucus, or often very offensive smelling. Sometimes very hard stool is also a sign of disease. Reduced defecation or complete stoppage, frequent lying down and getting up, and not sleeping at all. That is also sign of indisposition. And turbid urine. So you can see, even on physical appearance, we can give grading. So I am showing you 3 elephants: average elephant, poor elephant, emaciated, and very good condition. So this is a general, on that day that you have examined, she has a good body mass, but she may have problems as well. But I'm just talking about your general assessment. Now, what causes disease? If we know what are the agents, what are the factors that can cause disease, probably it is easier for us to identify. Because when you attend an animal, we must suspect, we must have a presumption that these are the factors that can cause disease, and accordingly we have to. So there are infectious causes, mostly bacterial, viral, parasitic, fungal, etc. So all these they have contributions. Trauma in case of elephant is very common, so accidental, malicious or infighting, nutritional deficiency, overfeeding. If you go to Europe or America, most of the zoos, they will have very obese, overweight elephants. A normal Asian elephant female should be weighing 4,000 kg. I saw one female elephant in Munich Zoo in Germany, which was 6,500 kg. So just imagine how plump she is. Okay? So then unbalanced feed, unnatural feed, and water deprivation, which is very common. In our Nagaland, anybody from Nagaland? So in Nagaland, actually rivers are here but far away. And the logging elephants, the mahouts, they are lazy to take for drinking every day. So maybe they take 2 or 3 days afterwards. So elephants suffer from renal problem. I have seen many elephants suffering from renal problem that worked in Nagaland in particular because of water scarcity. Then lifestyle, excessive work is bad, lack of rest, that is sedentary lifestyle is equally bad, having no work to do. Environmental stress, excessive heat, cold, dry, all these things. Then miscellaneous causes, poisoning, obstetrical problem, just now we have seen fracture, infection, very common. If you go to South India, infection is very common because there they feed coconut leaves or palm oil leaves, which are very coarse in nature. So they not only damage the chewing surface of the molar teeth, because last molar appears at the age of 44 years, and that molar has to support the elephant for rest of its life. Now, when you are giving such coarse teeth, the molar become like smooth and it cannot chew. As a result, the coarse fibers, they will be infected in the colon. So infection of colon is very common in some parts of India, very uncommon in here in our part. Or in some urban areas where elephants are kept, people feed them Ganesh Baba, they feed with bread and along with plastics. So those plastics also cause obstruction and cause colonic infection. So infection is there, then pulp decay in task tissue, various task tissues are there. Then I must say, though there are so many positive agents, in our condition, if you ask me, what is the most common infectious cause of these elephants in like in Assam? I would say parasitic diseases. Because of high humid climatic conditions here, a lot of water, the parasitic load is very high. So 3 types of helminthiasis parasite: nematode, trematode, and cystode. So nematode and trematodes are very common rather than cystode, not very pathogenic. Nematode, strongyle, even ascaris you will find, and trematode you will find parathystomiasis, fascioliasis. You do not have to be a parasitologist to be able to treat elephant parasitic diseases because drugs are just 2 or 3. Okay, so they are there. Then hemoprotozoan diseases, Babesia, trypanosoma, you know that. Fortunately, the hemoprotozoan diseases are not very common in these parts of country, but in the western part, in Rajasthan, in Gujarat, or Western UP, you find hemoprotozoan diseases, trypanosoma. We don't have, because we don't have the vector species here. Then filaria, Cobaldia is again found only in the food hills of Himalaya. So geographical distribution is also important, and ectoparasites. So you can see the live strongyle parasites in the freshly voided bolus in an elephant. So these are strongyle parasites, and you know how their ova looks like. You can easily diagnose. Now, whenever there is a gastro-intestinal helminthiasis, you find these symptoms: geophagia, eating of mud, frequent colic, pot-bellied appearance, anorexia, and anemia, foul-smelling diarrhea, not always, edema on lower abdomen and neck, dehydration, and anemia. So here you can see at the neck, in the submandibular region or in the neck region, which is soft and dependent in case of elephant, when there is a hyperparasitism, there will be what we call hypoproteinemia, and as a result, because the protein is competitively used by the parasites, so the animal suffers from protein deficiency. You find this type of edematous condition. You find this type of edematous conditions under the belly, right? So this is like nursing mother. She has parasites. She also may have nutritional deficiency. So collectively, you find that there is a low protein level. Now, these type of conditions, when you are treating, you always have a tendency to puncture and drain out the fluid. Resist that tendency. That is a negative approach. The issue is there is a hypoproteinemia. You go for increasing the osmolarity of the blood, the fluid will be absorbed, reabsorbed. You see the filarial, cutaneous filariasis. So these things are common in our part because of the presence of the filaria in the tissue sections. Then the hydathic cyst in the liver of an elephant. Okay, trypanosoma, not from our part. This was from Orissa actually. You can see those boat-shaped parasites, trypanosoma parasites. Covaldia, it's a botfly. Covaldia elephantis, mostly seen along the foothills of Himalayas. So in Assam, northern belt, in some parts of Bhutan and Arunachal Pradesh, and this is very common. This is a very notorious parasite and it can kill also. Very difficult to diagnose because you do not find anything in the stool. Only you have to treat based on your past experience. They can kill. Then the hematomyces, the lice, that is. The infectious diseases, bacterial, tetanus, HS, anthrax, clostridial diseases, tuberculosis, leptospirosis, urinary tract infections, GI tract infections. So these are various bacterial diseases that we come across in elephants. So out of these, you know the symptoms. It is just like any bovine. Symptoms are not different. You remember that against tetanus, against hemorrhagic septicemia, against anthrax, we can protect the animals with vaccination. So as a doctor, that is our priority. Anthrax is killing many elephants in Orissa last year, 2 elephants in Upper Assam New National Park, that is not Dibu Park. Notun National Park from Deem Patkai. Recently 2 elephants were lost. And this year we lost some 6 to 7 elephants to hemorrhagic septicemia in Orissa, Simlipal and other adjoining areas. So these are bacterial infections, they keep happening, and in wild elephant it is difficult to vaccinate, and you know the diagnostic procedures just like other livestock. So for actually your what is called the tuberculosis diagnosis, there are various methods. So this is a traditional dermatologic skin infection testing. The tuberculin is injected here, and based on that, with the blab formation, so that is indicative of a positive reactor. Then more reliable is a tranquilus. So we have to give 200 ml of sterile normal saline into the trunk, collect the sample, and then we take it to the laboratory for identifying the mycobacterium organisms. Okay. So guidelines for control of tuberculosis in elephant given by National Tuberculosis Working Group in 2000. Anywhere, there are a lot of debates regarding tuberculosis because this type of test, not tranquilus of course, the tuberculin test or the intradermal test or even the plate agglutination test, they can give false positive also. Elephant suffering from fasciola can also test positive to tuberculosis. So this is a big international issue. Now people have stopped much headache with this because it's a long story. One day I will tell you. So the trunk was a big syringe, saline is pushed here. Then you see this is collected in a sterile bag, which is then taken in centrifuge, and then see mycobacterial organisms. Not very clear, but when you can demonstrate them, that means a positive case of mycobacterium tuberculosis in case of elephant. So in one of my experiments, I have examined 83 number of elephants. Out of that, 2 elephants tested positive. And these 2 elephants we have treated with the human formula, that is isoniazid and streptomycin combination. And in the other one, Solanex, ampicillin, like that. And the treatment continued for 4 to 6 months. And fortunately, in both the cases, they responded and they become negative after about 5 months. But we continued treatment for 9 months. And both the elephants are still surviving. Now, the survivor after the tuberculosis infection, you can see that. Then tetanus is also seen in case of elephant, because the injuries in the leg by chain or a wild elephant stepping on an antler or like that, you never know when the animal can get infection. If possible, you give tetanus toxoid as a routine work, but when it is not given, you can see this type of symptom. The elephant will try to drink, but the trunk becomes stiff. It cannot, and the paralysis also, pharyngeal paralysis, it cannot swallow, and there is a stiff gait. This is comparatively rare. Partial and complete locked jaw, stiffness of the limb, jerky movement, complete offset, and very high mortality. If you can find a case early and if there is a history, of course, laboratory test, we can reduce the rigidity by diazepam, anti-tetanus serum, 2.5 blood unit is given, then penicillin, very large dose of penicillin, 12 hourly. But in my case, I have treated 3 cases. Of course, all the cases were very late case. I could not save a single one. Then HS is also, fortunately, though we got serologically positive cases, but no clinically affected cases here in Assam. But in Odisha, recently we lost 7 to 8 elephants to HS. So sudden onset, then anorexia, edema on throat and lower abdomen, labored respiration. Their lung is the primary organ for infection, and diarrhea. Diagnosis by microscopical examination of blood and finding bipolar organisms. Sulfamethoxam and oxytetracycline can also be given for treatment. But vaccination, of course, I'm showing anthrax. Here also sudden onset with high mortality, high temperature and shivering, hot and painful swelling on legs, shoulder and lower abdomen, labored respiration, diarrhea, bleeding from the mouth and other natural orifices. And in case of wild elephant, you will only see them after they are dead. Okay, so for veterinarians, this is a big issue, because the government will ask you to give a definitive diagnosis. So when you see a carcass suspected to death from anthrax, what to do? You cannot perform necropsy, autopsy operation. You cannot perform a necropsy. You cannot open the carcass. But you can collect some blood sample from the tip of the ear and the bacterial injection and that type of test we have to do and say before doing anything with the carcass. Now the carcass has to be incinerated. Okay, and the whole area has to be kept isolated from other livestock, because any livestock can also be affected. Anthrax is a dreaded disease. So diagnosis of the animal, post-mortem examination, and post burial management is also equally important. You have vaccination. In case of all other animals, all other diseases, the vaccination schedule for elephant is also similar to that of cattle. cattle dose, but not in case of anthrax. Anthrax dose is little bit higher compared to, so you can see the dose. Up to 5 years, it is the same 1 ml like cattle dose. But as the elephant grows bigger and bigger, the dose also increases. Then salmonellosis is very common in young elephants, particularly, which is from foodborne infection. So, hand-reared calves, particularly, you will find salmonellosis because of lack of sterility and like that. So, they suffer from severe diarrhea. The metrozil and chloromycetin succeeded as a treatment, along with sufficient rehydration. Animals die of rehydration as well as hemorrhage. So, if you can treat early, because this is a bacterial disease, we can handle. So, from severe salmonellosis, this can happen. What is this? Intussusception, telescopic invagination. So, this happens because there is a severe straining, and as a result, and so this was a by chance discovery for me. A calf died of severe enteritis, hemorrhagic enteritis, and when I performed a postmortem examination, I found this. Now, there are viral infections also killing elephants. So, out of that, I am talking about rabies, foot and mouth disease, elephant endothelial herpes virus, and EMCH, encephalomyocarditis virus, which is an instant killer. Elephant is affected with EMCH, will die within 6 hours. Okay, very high temperature. I got one case, EMCH. EEHB is an emerging disease, elephant endothelial herpes virus. So, I think 2019 we held one, no, in 2020, an international seminar on EEHB. It's an emerging disease. It can kill elephant. I'll come to that. Foot and mouth disease, just like cattle, but it is not as explosive compared to that of cattle. If there is a herd of 40 elephants, maybe just 2 will be affected with lesions in the tip of the trunk and mouth commissures and in the interdigital spaces. And in one worst case, I have seen the foot pad was sloughing off. Rabies is, 100% fatal. So it's difficult to say that the dog can, but then the elephant lives in forest. So jackal can be a carrier of rabies, symbiotic rabies. So they might have done. I have seen 4 or 5 cases of rabies in case of elephant, and like not all the cases were violent. At least 2 cases were very subtle like that. 2 to 3 cases were violent. Anyway, so these are the viral diseases. So EEHB I want to discuss a little bit in detail. So the herpes virus is found in most of the mammalian species, including us. Whenever there is a depression of our immunity, this virus can cause infection. The primary host in this case, EEHB, is African elephant, and rarely severely affected. The African elephants are, but the Asian elephants, which are secondary hosts, are severely affected. Now, many things are still not understood. Initially, it was told that the Asian elephants were infected from African elephants kept together. But we have seen that many totally unrelated groups were also infected. So how deep they were infected? So some interesting studies are in progress. Now there will be generalized. This is a basically hemorrhagic disease. So generalized hemorrhages in the heart, liver, intestine, and tongue. On postmortem, you will see severe lesions and sudden onset, lethargy, anorexia, mild colic, edematous swelling of the particularly head region, trunk region, and cyanosis, the purplish discoloration of the tongue. This is happened in case of elephant calf. So you can see this, the purple discoloration of the tongue, and they affect elephant from the age of 2 years to up to 10 years. 4 years is a very vulnerable age. Okay, and treatment is acyclovir or famciclovir. We give very high dose, 15 to 20 milligram per kg body weight every 6 hourly to start. Then next day 8 hourly. Then next day 12 hourly, like that. Orally. Now the problem is such young calves are not trained, they will refuse. And parenteral drugs are only just now started coming. If injection surgery, it is good. Besides that, we also have other treatment. So I said acyclovir, famciclovir, flumizine macrolide, then fluid therapy. Okay. Some people also give antibiotic, fearing that there will be secondary infection in those areas of intestine. Antihistamines and a lot of fluids should be given. And if the animal is not showing any diarrhea, you can go for parectal rehydration. Okay. FMD, blisters followed by ulcers in the mouth and foot pad. Then high temperature, separation of food pad, salivation, just now I have mentioned. Then treatment, application of Castellana solution, antibiotics, and combination of other antibiotics. Surgical affection are also many. You have fracture, abscess, cyst, gall, trauma, gunshot wound, spear and arrow injury, burn injury. You name anything, you find them in elephants. So here you can see a peculiar, the whole back of the elephant is involved. This is called Farah gall. Actually, this area is called Farah, just behind the soldier, where the chain is tied for dragging of or hauling of log. Now, because this area, just like yolk gall in case of bovine, so because they have a very thick skin, once a gall is formed, then it is not treated or realized by the handlers. They continue to use this is infected. So, because they have a very thick skin, unlike in other animals, it doesn't show proper pointing. Here it is showing little bit because it is very old. In other animal, if you do not operate, it will burst open and automatically pus will be drain out. In case of elephant, because of that thick skin, it doesn't drain out. So it moves because of the presence of proteolytic enzyme in the pus. It will move under the skin, and you can see this type of situation will form. So this animal is under sedation, and so I am giving an incision there for drainage of pus. So the treatment approach is simple. You drain out the pus, irrigate the cavity with potassium permanganate lavishly, then pack it with sterile gauze impregnated with tincture of iodine. So when it is not done, then it will be ruptured like this. The handlers, in spite of the animal having a gall, press the saddle over it and it ruptured. And you can see the hole inside. It is healing. Now, this type of color is showing granulation. But the problem is, it has to be epithelialization is there. Skin has to come forward from all sides. So it will take some months for complete healing, but it happens. This is actually a chronic bursitis in that area, over the scapula. Okay, scapular spine, there was uneven pressure. So because of that friction, bursitis has developed, which is very common in case of elephant. Very common. So this is the zygomatic bursitis. So this is the zygomatic bone here. So some elephants, they have a habit of dropping their head suddenly with a thud. So every time they lie down, they hit over this region, and that forms this bursitis. So you can initially you can try with drainage and injection of corticosteroid and antibiotic. But if it is generally we don't get fresh cases. So in that case, we prefer to for surgical bursectomy, complete removal of the reflect the skin, and the entire bursa is dissected out and covered. Then I mentioned about the arthritis. So here you can see in the carpal joint there is an arthritis. Can you see that? This is a case of fracture. I am only giving you some reference photographs. There are hundreds like this. And incidentally, this was in Anand, Gujarat. I was there attending Indian Society for Veterinary Surgery conference, and a circus was stationed, and they called me, and there was a fracture involving the animal. So I suggested them to ship the animal to a pond, which they could not manage in Anand, and eventually this unfortunate elephant died. So this fracture happened when the elephant was actually lowered down from the truck. So they have used all the pulley and everything to keep the elephant standing. So this is another elephant with similar injury, a fracture, but it is here in Assam. So as per my suggestion, they found a pond, and you can see the elephant spending its time in the pond. So because of their vertical bone orientation in the limb, you just keep them in water, half submerged, and the bone will heal automatically. You do not have to do any plastering or anything. And probably you know that their bones, limb bones, do not have the marrow cavities, so you cannot go for intramedullary healing. Even bone plating is also very difficult because there are a lot of cancellous bone, and screwing, it is very difficult to drive the screw in. Anyway, so this was the naturopathy. This elephant whole day it will spend in the water, then in the evening it will come out for feeding, and eventually the elephant become all right. So this we can learn from there. There are freak injuries. So this elephant hit its leg on a truck. You can see so nasty injuries, and after trimming properly and all that, we can see that trimming, tincture of iodine, gauze and all around. Then medication soup that we developed, very cost effective, very cheap, from truck tires. You can also design. Then you can see the feet is medicated, it looks better, and it can be cured, very cheap. Hardly it will cost 200 rupees to me. So for medication of elephant shoes, elephant food, we can design it. So lots of injuries, what to say, I will just skip this. This is a head injury. The elephant dropped from a small hill. And what to do with this elephant? Somebody has thrown a spear, the farmer, in an attempt to protect their crop. So in such cases, you have to treat it. But such a huge wild elephant, here comes the use of tranquilization. So tranquilization has to be done like this. You can see that very risky, but you have to do it. This type of many such cases we have operated, and we have removed the spear tip from a young elephant here. This is yet another elephant injured from infighting, where kunki elephants are very useful. You can see the mark all around, and it's very difficult to approach. So actually treating an elephant, every second case is a different case. So like that, we have to understand this is a gunshot wound. I have seen in those areas wherever there are crop raiding by wild elephants, some people, they shoot at the elephant, and particularly they target the carpal joint. I have seen at least 10-12 cases where the gunshot wounds were here in the same place. It's very difficult. So if you can remove the bullet like this, after opening, we remove the bullet, and eventually that elephant was cured. Electrocution. Nothing to do after this, right? But you have to distinguish from anthrax. This is a managerial problem in front of our department only, behind our department. Anyway, why I am showing this picture is that you can see this type of management of an elephant is called sambait or sitting position. There is another sitting position that is called lying down position, called terebai. So here we find that the elbow and stifle are injured because of the body weight of the. Now here it is grassy, but sometimes the handler will make the elephant lie down in pebble road or concrete road, and in that case, this will lead to injury in the elbow area. This particular case is a hematoma in the elbow, but there can be bursitis in the elbow also. So here it is in the stifle. The bursitis, which was again iatrogenic, some of our colleagues, they have punctured without taking sufficient precaution for asepsis, and they have administered infection, eventually forming an abscess. This is, I think this was EEHB. In EEHB, there is a hemorrhagic condition, but anyway, this particular color. So, commonly we do this type of program. I say healthcare program. Okay, preemptive healthcare program. These are the elephants in Kaziranga National Park. So, at least 4 times a year, all the national parks in Assam, we have over 160 such camp elephants in the forest department. So these elephants are attended by us at least 5 or 4 times a year for preemptive health camp. So we do ethical examination, we do general health examination, we do blood sample collection for hematology and biochemistry to be done here in the institution. We also do urine analysis wherever necessary. Then routinely we give vaccines. We have the list of that. So we give 5 vaccinations: anti-rabies, tetanus, foot and mouth disease, anthrax, and HS. So these are preemptive health camps. So another thing might be a question for students in particular, the dose computation. I tell you, proper body weight of that animal is not very important, but one guiding principle is that the elephant, they have a low BMR. So overall dose is somewhat less. And the biggest elephant will get 6 times the adult cattle dose for antibiotic, anthelmintics, and antiprotozoals. For biggest elephant, and as the elephant is smaller, then accordingly you have to adjust the dose. 6 times, 5 times, like that. Then 12.5 to 20 milligram per kg body weight for antiviral. Okay? Because this acyclovir or famciclovir we are not giving in other animals except in EEHB in elephant. So vaccines mostly adult cattle dose in all other except for anthrax, which is 1.5 to 2 times higher than adult cattle dose, depending upon the size of the animal. So, as I said before, TT, anthrax, HS, anti-rabies, and foot and mouth disease. These are the vaccines we routinely give. At least we can protect our animals from these conditions. There are many other conditions we should know. Route of administration, oral is common provided the elephant cooperates. Most of the time they do not. Intramuscular, all those muscles are there. Intravenous, ear vein or cephalic vein. It's better to use a cannula if you have to give it large volume, like 50 liters. Then subcutaneous dose anywhere, wherever there is a loose skin, particularly we prefer in the neck area or in the caudal fold. And parectal route is very, very useful in case of elephant because they have a very large rectum. So it can actually, and absorption is also there, takes place. So parectal route, provided the elephant is not suffering from any diarrhea. So here you can see we are going for a parectal route of rehydration. an X-ray of an elephant baby in our department. So there are not many issues when we talk of elephant diseases. I didn't have time to discuss all these particular cases. It's not a disease, it is a must actually, but it becomes a task for elephant, a life-threatening task. So with this, I want to conclude. Dr. Alawat.
Yes, sir, I am here, sir. Am I audible, sir?
Yes, you are audible, Dr. Alawat.
Yes.
I didn't check the time.
Sir.
Did I keep the time?
Yes, you are very much in time, sir. So, we wish to, from the organizing team, I am highly thankful to you, sir. Yes, we can hear you, sir. Kushal, sir, we can hear you, sir.
Sir, can you hear us?
Yes, we can hear you, sir. Students, indeed, this is a matter of great pleasure that Dr. Kushal Sharma sir has joined us.
I think my time is over.
Yes, sir. I think Dr. Vikas is also there. Dr. Vikas, you are there? Dr. Vikas Vora.
Yes, I am there.
Any suggestions, sir? Did you enjoy the lecture?
No, the lecture was very good and informative. In fact, we are out of touch of the therapies given and the case studies given to the elephants, and it was very refreshing that I have heard Dr. Sharma for this first time also, and a very nice presentation, and I think he is actively working for the cause of elephant health. Thank you, sir.
Thank you, Dr. Bora.
So any suggestions or any remarks from other faculty members who are online? Students can post their questions in the text box. So Kushal Sharma sir, thank you so much. We are looking forward to hear from you tomorrow again.
It will be my pleasure, but that is on Rhino.
Yes, sir, that will be on Rhino, sir. Thank you so much, sir. Thank you, sir.
Your dean of the faculty, he is not available or what?
Yes, sir. Actually, sir is busy with, we have another program here going on in the university level. So, sir is there with the Vice Chancellor over there, sir.
So, please ask him to stay tomorrow. I will check in the chair, and if I do not see Dr. Kang, I will keep mum.
Okay, sir. Sure, sir.
He's a good friend of mine. We are old-time friend. So please ask him.
1 minute. 1 minute. Please hold on. I am trying. If he is available, I will call him.
He's there.
He's online in his office, sir.
Okay.
Dr. Vilas Dodo is also there. Dr. Vilas, you are there?
Sir, please wait for a few minutes. He is coming.
Okay.
He is coming.
So any of one of my students will speak something?
Well, your students are also there?
Yeah, these are actually our internee students. So just now they have joined the internship.
They are internee students.
Internee students. So I that is why I just pulled them to my lecture today, and I'm asking them about.
I am really thankful to the students as well for joining this online training program. Thank you, students.
So tomorrow also they will come, right?
So how is Deepak sir? How is Deepak sir?
But is actually, you know, my mother is very critically ill. So actually very critical. I mean, I spoke to, you know, I am very doubtful what will happen to her. I don't know. Even today, like she was supposed to be released from the hospital as a very fatal case, like terminal case, so to say. Anyway, still with us. Our blessings are with us, and I don't know what may happen tomorrow. I'm hopeful that I will be able to join you tomorrow because my mother's condition is very critical. So Deepak is attending.
Sir, our dean is here, sir.
Okay. Good evening, sir. Kahan the?
Hello, KK. How are you?
I'm fine, sir. How are you?
I am fine.
So I said, if I do not see Dr. Tang tomorrow, I will not deliver my lecture.
Now I should not tell you KK, I should tell you Padma Shri KK.
Sure, you can. No problem. So,
how are you?
I enjoyed delivering the lecture. I am fine, but my mother is not well. I just mentioned.
Unfortunate, sir.
80, but that is not the factor. She had cholangiocarcinoma.
Oh, very unfortunate, sir.
Yeah, so last September she was implanted with a metal stent because the bile duct was totally blocked. And she was improved a little bit, but because they could not take biopsy, and moreover her age also doesn't favor, we could not go for any chemotherapy. So, and gradually she is going down, and right now she is in a very terminal stage. She is in the hospital.
We pray God that she get release of suffering and enjoys your services and all that. As a son, that is more than Padma Shri if you can serve your ailing mother at the end.
Dr. Then, when I received the news from Delhi about my Padma Shri, my mother was the first person to whom I reported. I informed her that Ma, I got an award called Padma Shri. So she said, that is mine.
Yes.
So, anyway, that way at least I am happy that I could give something in return for upbringing. And
proud of you, sir. We are proud of you. And we are very fortunate that we are able to see you frequently. Last, I think around April or so also we met on virtual platform. And this is one more opportunity that I could see you online.
Thank you very much. Your greatness that you remembered me, and I am here.
It reminds me the stay at Ludhiana, 21 days.
Yes. So thank you.
How is
Namaste. We will see tomorrow in the afternoon.
Yeah, definitely I will attend, sir.
Okay, please be there.
There may not be any administrative hurdle, and I will try my level best to be with you tomorrow also.
Sure. Thank you very much.
Yes.
Thank you, Kushal Sharma, sir. It is always a pleasure, sir, hearing you. So, students, in continuation with the technical program, now we shall be hearing Dr. Shri Anirudh Vasawa. He is a research coordinator of Voluntary Nature Conservancy at Vallabh Vidyanagar, and Dr. Anirudh Vasawa shall be delivering his presentation on translocation as a tool for the management of crocodile populations. So, till now we have been hearing academicians, scientists. So now I think we will have a very different perspective, Anirudh sir. And we are looking forward to hear from you.
Thank you so much, sir. Thank you so much for welcoming me. Am I audible?
Yes, sir.
Great. So thank you for inviting me in such a wonderful program, which was not actually feasible, in practically, but of course the virtual platform has taken the world now. So I think what we didn't expect before Corona, that whole thing, you know, kind of will be on virtual thing, all conferences and workshop, you know. So actually this is saving a lot of money. Okay. Taking, you know, all 300 people, scientists traveling from all over the world to a single place, you know, traveling in planes and those kind of. So as an environmentalist, as a wildlife biologist, I think this is a good medium, you know. I think, and even if there is a practical feasibility of joining again in presence, this thing should continue, right? Anyway, I'm Anirudh Basawa, as Dr. has introduced me, Dr. Alawat. Uh, I've been a wildlife biologist for almost 10 years now. I have worked on large carnivores. Initially, I worked with the Wildlife Institute of India on tigers and leopards. I worked on another project which was to bring cheetahs in India. I'll be talking a bit about that also. So we were trying to bring cheetahs from Africa to India, and that project has again taken up now. So let me share my screen. Host disabled participant screen sharing. I think my screen needs to be.
Just a moment, sir. Just
yeah,
it is done, sir.
Has to permit me. Yeah, now I think I can share it. Okay. Is the screen visible now?
Yes, sir.
Okay, great. So translocation, I think a lot of talk has been conducted on translocation, and I saw some of the scientists are going to talk on translocation. So, but still, I think crocodiles have been kind of an ignored species in terms of translocation. We do a lot of translocation of crocodiles, especially in Gujarat and a lot of other parts of India. But, you know, kind of really a well-managed management plan to translocate a crocodile, treatment of crocodiles is not available. Okay, very few publications about the veterinary studies about crocodiles are available, and that too very few from India, right? So this, you know, kind of veterinary field in terms of reptiles, especially crocodiles, which is going to be a kind of problem in the future. Students should take up studies about crocodiles, right? So before we go further, let's see the charisma of this species, crocodiles. I think all the students are from undergraduate level, I think. So everybody has seen the Jurassic Park, right? Those, you know, different types of giant dinosaurs, those having long necks, those having large scales, and everything. And all the movies showed a very peculiar dinosaur, which they showed was very dangerous. You know, the most dangerous dinosaur they showed was this one, right? The Tyrannosaurus. We usually refer them as T-Rex. And all the dinosaurs feared this dinosaur actually. Okay. We had wide variety of dinosaurs, but this one dominated the land. But you know who dominated, who overcome these dangerous species? Crocodiles. Crocodiles have been on this earth for more than 200 million years. There were different species in Jurassic time, then different eras actually. But you see, there have been extinction, mass extinction. There have been ice ages. Okay, you know, wiping out a lot of population. Extinction. I think there were comets which stuck to the earth, which destroyed a lot of species. But somehow these species, these crocodiles, okay, they survived. Okay, people are really starting to understand why these crocodiles survived those extinction, which wiped out other species. Okay, almost all dinosaurs wiped out, but a species which was born, which was evolved before the dinosaur is still surviving. There is something in this species which has made it, you know, top predator survivor. See, this is a fossil that we found. Okay, it's a Dinosuchus species, kind of, it's a group of the crocodiles these scientists consider that were huge. Okay, scientists are finding new and new fossils of this species, and this was referred as a terrible crocodile. You know, terrible crocodile. So Dinosuchus comes from Greek word which means terrible. So the name was given. You see the size of this crocodile. Okay, the skull of human is like a, like a angur, like a grape to this crocodile. Okay, Even a touch of the crocodile will just crack open the skull. So they were so huge. And it looked like someone like this. Okay, like a modern gharial crocodiles actually. They had a very long jaw. Okay, there was a bulging on the the top of the jaw. They look more like a present crocodile, but there was a various species, other species of the crocodile as well, which survive at the same time. Okay, this crocodile was almost 90 feet long. There were species, other crocodile species at that time, which were 50 centimeters small, just 50 centimeter. This was also a crocodile species. So see, you can see the variation of these crocodiles, right? So once you understand that species has survived so much, it has such an inbuilt ability, such a capability, such skills that made them survive crores of years, right? And we sometimes people refer to them as like living fossils, right? So now, currently probably there are 25 confirmed species of crocodile. There is a genetic study which is ongoing. Scientists are working on that to confirm like how many species are there in the world. Very recently, the Nile crocodile, which is surviving throughout Africa, was divided into 3 species actually, but still it has not been accepted. In the scientists are working on that thing. But globally, there are 25 species surviving in different parts of the world. And you can see there's all the species of the crocodiles. They survive in the tropics. Okay, none of them are in the polar region or northern hemisphere, right? Because of their availability of food, and also that the crocodiles are ectothermic. Okay, they cannot survive extreme climates. So, and especially the colder climates. So they avoided those areas, northern hemisphere, and especially those areas, and they are surviving in the tropics. Okay. The green one shows that the crocodiles which are surviving on land, and the blue color shows that it is for the saltwater crocodile which is surviving. Okay, and some of these alligators and camels also survive in the this South America and USA corridor. Okay, that's the Mexico and that thing. I'll show you a small video of just to give you a glimpse of like how many crocodiles survive currently. Just a second, hold on. American alligators. You can see the diverse verifications of this species. This gharial, which is found in India. Looks like gharial, but not gharial. Okay, so you saw the different crocodiles. Okay, small and big, and they had different kind of snouts. In India, we have basically 3 crocodiles. Okay, the saltwater crocodile, which is referred as saltwater salty sometime, or estuarine crocodile, because it is not actually a saltwater crocodile, but it is found in brackish water, estuarine water, and also can survive in the fresh water also. Whereas the mugger crocodile or the marsh crocodile is widely distributed on land, and it is found majorly in rivers, pond, lake, canals. I think it can survive anywhere. It's one of the finest survivors. The bottom one is the gharial, which is probably the most primitive crocodile species which is surviving currently. I think I showed you the picture of the primitive crocodile, which looked more similar like gharials, right? This is very specific crocodile which feeds on only fish, very specific. It doesn't have food. It's actually feeds on fish only. If you look at muggers can feed anything. They can eat, the buffalo. They can eat goats. They can eat chicken, small crabs, even sometimes insects also. Likewise, saltwater also, it feeds on different types of prey, but gharial specifically feeds on fish only. And gharial is very habitat specialist. If there is a contamination in the water, the gharials cannot survive. Okay. Whereas a mugger and marsh crocodile, there is a place in Gujarat, which is now Vadodara. There is a river, Vishwamitri. It's like a gutter. It's a polluted river. Okay. The crocodiles, the marsh crocodile is surviving like anything, thriving actually. Okay. So this is the difference between all these species in India. People also get confused sometimes whether the alligators are found in India or not. Okay, a lot of has this conception like India has also alligators, but no, we do not have alligators. Alligators are found in USA, parts of North America, South America, and parts of China. But in India, Indian subcontinent, we do not have alligators. There is a difference also, you can see. Okay, in the structure of the snout, the structure of the jaw. Okay, you can see that crocodile has a very narrower jaw compared to alligator, which is more like an oval-shaped jaw. Whereas the gharial, you can easily distinguish like a big, like a structure. You know, it is referred as gharial because when the males get mature, there is a ghada-like structure on the top of the snout. That's why they are called as gharial. Right. So in India, we have only gharial, mugger crocodile, and saltwater crocodile. We do not have alligators. Now, these crocodiles are facing a lot of threats. As I said, that gharials cannot tolerate polluted water, disturbed habitat. Whereas mugger crocodile, marsh crocodiles can tolerate different types of habitat, can eat different food. So what are the threats these crocodiles are facing? Poaching. Poaching used to be one of the biggest threat to the crocodiles. I think before 70s, before the regulations came, before the rules came, poaching was the biggest threat that wiped out almost 80% of the population of crocodiles of different species in India. Then there is habitat loss. We are kind of we are dumping wetlands and ponds to create land for agriculture, to create land for industrial. And that is the kind of biggest threat now. Water pollution. Very recently, like 7-8 years back, there was a massive die-off of gharials in Chambal River. Okay, scientists went there and studied the different factors, different criteria, different parameters. What affected those die-off, large die-off? And water pollution came as one of the biggest reasons. They died because of water pollution. Their body, they started eating those fish which were contaminated, and it affected gharials. Okay, and majorly it also affected the gharials directly. Okay, because they were living in a contaminated water, or water containing heavy metals and different pollutants. So, illegal trade, not so much a bigger threat now, but it used to be before the rules. People used to illegally, because for their skins. And crocodile skin is one of the most costliest, leather you can find in the world. People pay a lot of money to get crocodile bag. You can see this is a beautiful piece of, jewelry, you can say. Okay, it's a bag made out of complete crocodile. You can even saw the jaw also. Okay, it will be, I think it must be costing around like $3,000 or something, and probably more than that. And of course, the fishing, illegal fishing, when there is a fishing without any regulations, without any management. Okay, so these crocodiles get caught up in fishing nets and they die off because of suffocation. It's not like that these crocodiles can survive underwater. They have to come out of water to breathe. Okay, they need to breathe. They're not like fish. Every an hour or 40 minutes or 30 minutes, they have to come up the surface of the water to breathe. Okay, when they get entangled in fish net, they cannot come for breathing and they get suffocated. Egg predation by humans in certain parts of India. People eat their eggs of crocodiles, especially on the the eastern coast of India, the Orissa and West Bengal and certain parts, the eggs are eaten by humans. Body parts as a medicine. A lot of rural people, a lot of tribal people believe that meat of crocodile is an aphrodisiac. Okay, it has medicinal properties. And to be very frank, it's actually true. It's actually true that very recent scientific studying and making an antibiotic out of the crocodile's blood. In USA, in Europe, scientists are working on making medicines out of the blood of crocodile, which has a very good antibiotic property. A lot of time we see crocodiles which have been injured here, but they do not get infected. There is no infection in them. Even their limbs get chopped off. There is no infection. A lot of times, and so their immunity is such a good. Their antibiotic, kind of self-healing property is very good. Then there is one of the biggest threat currently we are facing is the conflict with humans. Conflict with humans. Where there is a large population of crocodiles, the crocodiles are attacking humans. Okay. A lot of people have died because of crocodiles, different species of crocodiles. You can see these two pictures are from Gujarat, especially from Vadodara region. On the right, the crocodile got hold of his leg and chopped off the leg. Okay, on the left, you can see the kid actually got, kind of escaped from the crocodile's jaw, but his hand is really seriously wounded. This is a simple graph. You can see that which species in the world is the most kind of dangerous to humans in terms of attacking. So you can see saltwater crocodile has attacked the most people. Then comes the Nile crocodile, and the third one is the mugger crocodile. Okay, this data is a bit old. I haven't kind of looked at the new data. This is a bit old, but you can see that which species is more responsible for conflict. This is a data that we mapped in Gujarat for the most conflict area. This is a Narmada River and Vishwamitra River system. You can see the more red the dot is, it is a more conflict areas. Currently, we have recorded nearly 150 attacks on humans by crocodiles, by mugger crocodile. So now there is a conflict. Why do crocodiles attack? Of course, when there is a breeding season, when there is a nesting timing, they become aggressive to protect the nest. When the babies come out of the eggs, the hatchlings, okay, the parents actually become really aggressive to protect those hatchlings, okay, up to at least 2 years. People have seen like protecting their juveniles, babies for at least 2 years. Territoriality, sometimes these crocodiles are territorial. They do not want to share their habitat, their area with other crocodiles, and sometimes with human also. So sometimes they, kind of attack because of territorial behavior. Mistaken identity, what does it mean? See, of course, crocodiles can eat humans. It's not like that they cannot eat humans. They can catch anything they can get hold of. So what is a mistaken identity? What happens is like they usually do not attack humans, but what happens like when a kid or a lady who's washing a clothes or utensils, a kid who is playing nearby a water, a wetland, okay, the crocodile mistakes it for a ungulate, a goat, or another species, and attacks it. Okay, and that's how they get kids or anybody, whatever the woman who is sitting there can die. Okay, it becomes fatal. So that's a case of mistaken identity. They do not want it to kind of catch humans, but by mistake they caught humans, right? And sometimes the crocodiles become so big. Okay, you can see the size of this crocodile. This is one of the biggest crocodile in the world, long. Okay, you can see how many people are sitting on that, still it's so long. Sometimes people are so large that they actually see human as a prey. They can actually attack humans to feed, to catch them. Now, let's focus on conflict now. We'll not be going to different threats, but let's focus on conflict. Okay, so how can we minimize this conflict? How can we minimize the attacks by crocodiles? One of the best way is to create awareness. Okay, and this awareness must include how to be safe from crocodiles when you are around such areas. Okay, what precautions you should take when you are around river, when you are around pond and such areas. Okay, so awareness training is the biggest, greatest strategy one can apply for mitigating conflict. Then now there are barriers which you can also put in your area, in your river or ponds, which are enclosed by a certain wall, kind of a barrier. Okay, so people use these areas. So crocodile can actually not go inside these areas. So people can safely use these areas for different uses. This has been again very effective in minimizing the conflict. Sri Lanka has been using very widely. In India, we use this CE very regularly in Charota region, in Anand and Kheda. I think almost every village has this CE created by the forest department. Now translocation, let's come to the topic translocation. Okay. Yeah, this is not the way translocation is done. Okay, this is a picture from Africa. Okay, sometimes what happens, there is no solution to this conflict. You know, the crocodile has to be caught and removed to different areas. That's what is called as translocation. We'll be talking in deeper about translocation now. See, very recently, I think a lot of people know about, there was an incident, there was a kind of government wanted to remove crocodiles from the Statue of Unity areas actually, and wanted to develop that area for tourist purpose. Okay, of course, it's tourism purpose. But there are so many crocodiles. It's so tedious process. It's not really possible to, kind of remove all the crocodiles. Okay, the debate is still ongoing, but this is how what was happening was translocating crocodiles from Statue of Unity area. So what is translocation? It's nothing. It's just moving an animal, moving a crocodile from one area to a different area. Okay, in simple words. But there are different types of translocation. Okay, one of them is introduction. What is introduction? When there was no population of that species in that area, and you introduce that species, you translocate one species, you translocate a crocodile into that area. That is called as introduction. Okay, it is not a natural process, but sometimes scientists and forest managers do it actually, right? And another is reintroduction. The species was there earlier, but somehow it got wiped out, got extinct from that area, like cheetah. India had a lot of cheetahs actually. But in 1956, I don't remember the exact year. So cheetah got wiped out from India. Okay. So I was working on another project, which project was to bring cheetahs in India and to rewilder the habitat, especially the grassland and dry habitats which cheetah inhabit. Okay, to revive those habitats. Okay, that's reintroduction. Restocking, still there is a population, but it is not a very successful population. It needs support from outside population. Okay, that's called as restocking. So when in early 1970s, when the crocodiles were really getting destroyed, like they were getting wiped out from different areas because of poaching and other reasons, habitat loss. Okay, government decided to restock those areas, and there was a massive restocking program by the government, and it actually worked. It actually brought the crocodile species from extinction, actually, not a local extinction. Okay, so what are the steps of this translocation? First thing, why we are doing a translocation? Our aim should be clear, whether it is for a scientific purpose, whether we want to revive a habitat, what is our aim? That should be very clear. Okay, and the second thing, support of the local stakeholder. People living in a new area where we want to translocate the species, crocodile or anything. Okay, whether the people are supporting the translocation, if not, it is not going to be viable. The people are going to kill those animals. Okay, they do not want that species there. It's not going to work. So it is very important. It's eminent that we support gain the support of local people, local villagers, local stakeholders. Right. Suitable source population is also important. Source population is something from where we are getting the individuals for translocation. It should be healthy. It has to have a substantial number of individuals for surviving. Okay. And of course, the proposed site, whether it is suitable for the new translocation, for new introduction, it has to be assessed. Of course, how many number of individuals we need to translocate is also important. We need to translocate certain amount so that it becomes a surviving population. It becomes sustainable population. You cannot just put 2 or 3 animals and it will become a sustainable population. No, you have to put certain amount based on species, and we have to maintain a ratio of males and females. Okay, to make it to be a sustainable population. Okay, and of course we have to take care of transport and move the animal as soon as possible. We also need to manage the translocation monitoring. Our forest, kind of managers, our scientists really miss this point, post translocation monitoring. Once we translocate, what happens to those animals? We really don't have those data. Okay, this is the area This is a gray area. What happens to those animals? We do not have data. And of course, in India, translocations are illegal. In Gujarat, we have a lot of translocation in Vadodara, in Saurashtra, in Anand and Kheda. Every year, like 30, 40, crocodiles are rescued from wetlands or rescued from home and villages and are put to different areas. All this is illegal. Without the permission of Chief Wildlife Warden, a prior permission, a written permission, nobody can touch a crocodile. Nobody can do a translocation or a capture of a crocodile. Okay, a prior permission, a written permission is necessary from the Chief Wildlife Warden of the state. Okay, it's illegal. You can see the Wildlife Protection Act 1970 allows an animal to be captured. It has become a danger to the human life. If it has become a danger to human life, remember this word, it has, it will. We are not, it is not saying that it will become, it has become, it is already become. Then only you can do the translocation. Okay. So some of the conditions, some of the scenarios where we need to translocate a species, crocodiles are given here. First thing is the crocodiles attacked a person or few persons. Then in that case, you can translocate. It is becoming aggressive. It is showing aggressive behavior. Okay. Then you can translocate. The location of the crocodile means the habitat it is surviving. Okay. It has become a potential threat to the crocodile itself. Like a well, sometimes a crocodile falls into a well. Okay. It will not survive for very long into that well. It has to kind of go for food. It has to go for, kind of mate. So it becomes dangerous to crocodile itself. So in that case, we have to translocate it. Sometimes people don't want the crocodiles. They say that we will kill this crocodile if you don't take the crocodile from here. In that case, we have to, kind of take the crocodile. The crocodile is injured, severe injuries has happened to the crocodile and needs a critical care, needs a medical attention, then you can translocate. And so these are, I already mentioned the scenario. So what are the capture methods? There is a direct method, there is indirect method. In direct method, people actually are involved in direct capturing the crocodile through ropes and through snare poles and everything. Whereas in indirect, we just put a trap. Okay, the crocodiles, gets lured into the trap, whether it is a kind of cage or anything. So okay, so that is the indirect way of capturing the crocodile. We'll be talking a bit about capturing, right? So the crocodiles, while captured, they usually struggle. You must have seen some of the programs on Net Geo and Discovery. Once they put a rope on the crocodile starts kind of rolling. Okay, so that behavior or that pulling up of the behavior puts a lot of strain on crocodiles. Okay, and this can create a stress, not only physical, psychological also, right? And I think some of you know that there is a process known as acidosis. Okay, there is a large amount of lactic acid which is being created in the body. Okay, when you run, when one person runs, your legs feel there is a pain in the leg. That is because of the lactic acid formation. Similar thing happens in crocodile. Okay, you can see those in some of the programs. So because of that lactic acid formation, the crocodile can actually die. It may die because of the acidosis. So it has to be taken care. As I said, if there is a stress, it has to be handled very properly in a very appropriate manner. And of course, after a struggle, it has to have a good amount of oxygen to recopulate. Okay, recover from the acidosis, from the stress. So you provide such condition to the crocodile. Restraining methods and anesthetics, if used, must not impair breathing. I think this is much more a subject of the veterinary students. Okay, and I think students must kind of involve yourself in such projects. But the thing is that if you put a more dose of these medicines, okay, and you need to understand. Look, a lot of times when we are walking with mammals actually, which is a kind of warm-blooded animal. This is an ectothermic animal. It's a cold-blooded animal. Its metabolism is so strong, so weak. Sorry. Okay. So we have to consider all those factors while treating or while providing anesthetics to the crocodiles. So this is the way scientists use to capture crocodiles when they want to translocate. On the left hand, you can see that there is a made of the mesh net. On the right side, you can see it's a made of iron and this cage actually. And this is on the right side, it's a floating cage. Okay. So when you are putting such traps, you need to make sure that when the animals gets caught inside this trap, you should be there. Okay. Or else what will happen? If the water rises, the crocodiles will get suffocated. It will not be able to come out of the cage or this trap, and it will get suffocated. It will die. Okay, so the observation team, the team which is capturing the crocodile, has to be there every time, has to look over regularly. I'm not going into so much detail, you know, this is much of a different scenario. But of course, when you capture it, you need to have a very good equipment. Okay. Sharp equipment, sharp cages should be avoided, because although crocodile may look very strong, its skin may look very hard, the under part of the crocodile is very, you know, kind of soft. Okay, it's not so strong, and it can easily get injured because of you know, kind of inappropriate handling, inappropriate translocation or capture. Okay. You should keep the crocodile not very, you know, you should maintain the temperature also. Hot temperature can also kill the crocodile. Cold temperature can also affect the crocodile. So you should maintain the temperature, particular temperature which is required. Ropes are kind of useful while capturing a crocodile. You can see it's like a loop that we use to capture a crocodile. The rope has to be really strong. Okay, otherwise crocodile can break the rope and go away, and that is a serious condition. Nylon ropes, we prefer nylon ropes because it, even if it gets wet in the water, it does not get locked up or gets tight. Okay, otherwise you cannot work with those ropes. Okay, you can just put the rope on the neck of the crocodile, and it can easily get captured, and then you can do the further steps of restraining. Nets are also used the world over to capture crocodiles. But of course, the nets, as I said, has to be monitored regularly, or crocodiles can get suffocated. Once the crocodile is captured, it has to be rescued. Okay. Rescued in terms of, like, once the crocodile is captured in your trap or in your rope, okay, the first thing is to get you to hold up the jaw. Okay. It is because it is for the safety of the crocodile. It is for the safety of the people also, so that people don't get injured. Okay. The visual disturbance creates a lot of tension, okay, kind of in the animal, in the crocodile. So you should put a cloth or something like that on the eye so that it doesn't see people around and kind of gets less stressed by the people around. Okay. You secure the jaw with a rope or rubber bands or anything that you can have, which of course should not injure the animal also. This is has been a subject of debate, that whether when we are doing a scientific study, when we are putting a radiotech or you know, kind of studies, whether we should use, you know, kind of drugs on crocodiles because of its physiology, because of its cold-blooded behavior. Because if it is not, the dose are not proper, as I said, the animal can die. Okay, so the veterinary guy or veterinary doctor has to be present all the time during all this process. Okay, and there is a performer. The rule says that there has to be a veterinary doctor when such translocation are performed. I don't think so. In India, in Gujarat, such things are followed. Transport also needs to be taken care of. As I said, the lower part of the crocodile is kind of soft. Okay, it can get injured very easily. So it has to be laid on a platform if you want to transport to a shorter distance. Okay, the cloaca of the crocodile is one of the most sensitive part. Okay, so while transporting, you must take care the lower part, and especially the cloaca is not affected by the transport structure that you are using. It is not injuring that part. And also the head of the crocodile should always be above than the body. This is because if the crocodile has eaten some food and it is regurgitating outside, okay, and you have already captured the jaw of the crocodile, so what will happen? It is regurgitating, it is vomiting that food, it is not going inside. Okay, so animal can get suffocated through its own vomit or food. Right? So it should be avoided, and the head should be always held up compared to the body. Such structures, wooden structures, can be used for long transport. We are transporting an animal for a longer distance to a different city, different town. Then you should use wooden boxes. These are safe and are widely used in India. Release is the most important, also the most sensitive part of the translocation. The animal is already stressed. Okay, you have to take it to the animal to a certain area. Okay, so care must be taken, and of course the animal has regained its energy. It is angry. Okay, so it has to be taken. The care has to be taken. You can see this picture. So this is a picture of chambal. One of my colleagues was working on chambal in ghadial crocodiles, these ghadials. Okay, so they were radio tagging these ghadials, and they were capturing a lot of ghadials every day, and tagging. You can see the red part on the tail. Those are tags. Okay, color codes used to identify different crocodiles. I'll just show you another video that will help you understand how a crocodile is released. The animal is completely secured. The eyes are covered to stop the visual disturbance to the animal. So home, our colleague is removing the, kind of untying the jaw. Okay. So some of you might have been wondering why was the stick was put up near the head of the crocodile, the ghadial. That's because while releasing, when it's the animal is really angry, you can sometimes will try to turn and attack the person who is nearby. So that stick was put there to stop the jaw of the crocodile. So that crocodile, as soon as the crocodile touches the stick, it will try to avoid the stick. Okay, and will go into the water, straight into the water. Post translocation, as I said, what happens to the animal is not monitored at all. We just capture the animal, we just transport to different area, we just release the animal, and what happens with the individual, we don't work on that. Whether the animal has died, it's surviving or not, there is no data. Nobody is working on that. So post translocation monitoring is must, and I think it should be performed every time when you release an animal into different area, translocate an animal. So translocate has a lot of benefits. It provides an opportunity to study the animal in different habitat. Okay, what happens to the species which has colonized a new area. So it provides a chance to us. And I say that when you release a species, a crocodile into new area, okay, it has to be unoccupied by other crocodiles first. It has to have a sufficient area to relocate. So what happens, like these top predators, whether it is crocodiles, whether it is lion, whether it is tiger, how they play ecological role in restoring those areas has to be considered, and it is one of the benefits that the translocation can provide. You can say in India, nowadays there is a lot of translocation of tigers. In Sariska, the tigers got wiped out completely. Okay, and now they have relocated some of the tigers from Ranthambore, and again it's the ecosystem is regaining slowly and slowly. There is a breeding population of these tigers in Sariska now. Also, there is a concept that what happens if there is a disease outbreak in one population. Take an example of lion. People are suggesting that lion should be translocated because what happens if a disease comes to Gir, Sasan Gir? Okay, what happens if rabies spreads out across the population? So scientists are suggesting that there has to be a second population for such events. What if there is a fire? So translocation provides that there can be a second population which is safe and sound than this population if something happens to the first population. Of course, it improves the genetic diversity. If you're bringing an animal from different area, it has adapted to that habitat in a different way. So it has a different genetic diversity. And if you're mixing that animals into different population, there is a mixing of genetics into those populations. So it will improve the genetic diversity. And I think science students know that genetic diversity is actually, is important for sustainable population. Now what? Translocation. What are the negative, drawbacks of a translocation? Let's see it. Increased stress. Scientists have studied India and especially in abroad, different countries, USA and Africa. There is a lot of stress in the animals which are translocated. Negative impacts on resident animal. As I said, if there is already population in that area, okay, there will be a stress in both the population, the one you are relocating, and the one which is already existing. There will be a kind of conflict for the territory and food. Okay, so there could be a negative impact on the population. Again, negative, way of saying that conflict will increase. There is a chance of spread of disease actually. If you're transporting new population to different area and that population has some disease, it can get into the population where you are transporting into a new population. So there is a risk of spread of disease. Again, abnormal behavior, because see what happens. What happens if you put a human into an area which is not known to him? A person is grown up in a city. A person is grown up into. Take an example. Ahmedabad. He knows the place where to eat food. He knows the place where to drink, home, everything. You put that person into Antarctica. What will that person do? He doesn't know where to eat, where to feed, where to sleep, where to go. It will be completely depressed, completely, kind of stress. That's what happens with animal also. You put a crocodile, take a crocodile, you capture it and put somewhere else where the animal doesn't know what will happen. Where is the food? What I will eat? Where I have to be safe from people? There will be a very stressful situation for that animal and it will act abnormal. And this all can affect the reproductive success of the crocodiles. And ultimately, it can also lead to mortality. Social breakdown between released individuals. This population, if you're taking an individual which is related to other crocodile, and if you're taking that crocodile and taking that crocodile, there will be a breakdown of the bonding between those animals. Okay, so this can also affect the animals. Okay. Sorry. So now I think a lot of people know that there is a homing instinct. What is homing instinct? It's a natural instinct in all the animals, including humans, although we have forgot it. In all the animals, to go to the place where they were born, okay, where they know better. Okay. Studies across the world are showing that animals tend to move to the area where they were born. A crocodile I think especially there is a lot of studies in Australia where a crocodile swam almost 400 kilometers to reach back to the original place. And not only this, there are different other studies which says that crocodiles tend to go back to the original area where they were taken and released into different area. Okay, so ultimately the question comes whether translocation can be used to mitigate conflicts. Whether if we capture a crocodile who has attacked a person and we are translocating that crocodile to different area, whether this system works to minimize the conflict in a long term, I would say no. Okay, the animal which has translocated to different area will resume the nuisance behavior. And scientists have reported that attacks on humans have increased once the translocation has happened. So I believe, and a lot of scientists believe that translocation do not work to mitigate conflict in a long term. But of course, sometimes it's the only way to lead to, and people use it. So to conclude, I would say that translocation is a very important tool, very strong tool, very powerful tool. in a biodiversity conservation if done in a very proper way, right? However, there is a risk of for the animals which are being translocated. Okay, they can, there is a chances of mortality, there is a chances of stress. Okay, so certain things need to be taken care of, that there is a post-translocation monitoring of the species. Okay, suitable area is identified, disease testing is carried out on the animals that are being translocated. So when you take care of these things, I think translocation can work in a very, kind of very shorter way, but in a longer way, I don't think so it's a solution. Better mitigation methods are, as I already said, providing compensation to the people who have been affected by crocodile, who have been attacked by crocodile. There is you provide better protection measures to the livestock they have. You teach them to create awareness among the people that they accept crocodile near them. Okay, so instead of translocating the animal, there are some measures which are better, and if kind of given more thought, more resource to this solution, it can work better than translocation. Okay, I think I would like to conclude my presentation here. So these are the people and some of the funders that have supported my work over a year. Dr. Raju Vyas and my team of volunteers from my NGO who have been helping me in managing and monitoring the population in Charotar. Soham Mukherjee has been a colleague with us for very long now, and many of the photographs that I used in the presentation were provided by him for the use. So thank you so much. Thank you. I think I can take some questions, right?
Thank you, Mr. Vasawa, for giving nice and informative presentation with photograph or easy understand by the student. Now topic is open for discussion.
Yes, anybody want to ask any question?
Faculty member or any student wants to interact with Anirudh Vasawa, you are free to do it now. The topic is open.
This was less of an academic presentation and more of an kind of management presentation. I think you get that from this presentation, right?
It was very rejuvenating, actually, Anirudhji. So students must have enjoyed it. It was in a very student-friendly manner.
Yeah. I was given the information that it's for the first year students, so I didn't include a lot of scientific information. So
we could make out that. So thank you so much, Anirudh Vasawa sir. And we are
thank you so much.
Some more academic engagements with you in the future. And
definitely.
Surely, sir, I will come back to you once all these COVID restrictions are over, sir.
Definitely. Thank you so much. Okay.
So with this, with the permission of the chairman, I think we are ending the session now, sir. And tomorrow morning, again, we will meet at 9 a.m. This is for all students. Thank you, sir. Thank you.